Welcome. For those people who feel like you're slouched over, you feel like you're hunched over, sitting at a desk, on the typewriter, looking at your smartphone, driving like this all day, not having a support behind your lower back, this is a great stretch you could be doing on a daily basis. This will really open up that thoracic spine. It will really kind of take that hunching out. It will open up the chest, stretch the pec muscles. And at the same time, the second part of this is that we're going to actually stretch those deep hip flexors as well as the abdominal muscles by doing this stretch, because the ball that we're going to be laying on is going to bring us up quite a bit higher. It's going to give us a little bit of leverage on how we can release some of those other muscles, particularly the tight abs that pull us forward. So we're actually going to stretch it. Understand that just sitting down like this with your legs out in front of you, driving, being at a desk, contracts those hip muscles, those deep hip flexors, the iliopsoas muscles, and this causes this forward slouching, this forward crunching, having difficulty sitting up straight. Let's get to it. Here is a medicine ball. You can use any kind of ball, a basketball, a medicine ball, any kind of ball. And what we're going to do here is that we're going to lay on this medicine ball. Okay? So when we lay on this medicine ball, I'm going to lay on it. Okay, I want to show you on this angle. I'm going to lay on it where I want this between my shoulder blades, right here. Okay, that's where we're going to want to put that ball, right in that mid-thoracic spine. So when we put this ball back, what I want you to do, I want you to lay, if you're on a therapy table or something firm, you're going to be able to stretch those hip flexors if you're up off the ground. If you're on the ground, you're not going to be able to stretch those hip flexors. But the first part of this is that we're going to open up the mid-thoracic area. We're going to put it right in our mid-thoracic region. And you can keep one knee bent, the other one straight if you like. Okay, because we're going to do something right after. And take your hands out and just roll that ball slightly. You don't have to roll much. Just put it right in the center of your spine. And I want your arms just to fall back out like this, all the way out. Let your head back, relax, and let everything open up, okay? You're going to feel those chest muscles open up, stretch open. You're going to feel that nice inward pressure on the thoracic spine going the opposite way of that kyphosis. And what we're going to do now is that while we're up, watch what I do here. We're going to come a little closer to the table. Same position. And now with this right leg is bent, I'm going to stretch the left abs and the hip flexors. Okay, and I'm going to go ahead and hold the side of the table, and I'm going to drop this down. Wow. Just drop that leg down off the table as you hunch back, as you go back over that ball, and you'll feel those left abs open up, the hip flexors open up, and just hold that. Good. Beautiful. Let it go. You can actually take that toe and push it outwards like this, that left leg, and just let it fall off the table. Good. You really feel those abs and those hip flexors stretch. Now, if you're going to do the other side, it would be the same thing. You would be laying back over that ball again. Make sure you grab something firm because I don't want you falling off. Okay? And as we're like this, we're going to go ahead and we're going to bend this left leg. Take this right leg, let it come off the table. Good. As you go back, hold on to that table now, and you really feel these hip flexors and these lower right abs really stretch and open up. You can hold that stretch about 30 seconds. This takes a little bit of work, but again, laying straight back on that ball, right in that mid-back, really does the opposite of that kyphosis. It really gets us upright. It really stretches those chest muscles, letting those arms just dangle off to the side. And then if you're going to be off the ground, you can grab onto a table, wherever you're on, and then let one leg off that table on both sides, and you really feel those hip flexors and those abs really stretch. Share this video with others. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.